Hello, and thanks for being with me today. My name is Ann Lizardi. Today we're talking about prostate cancer, prevalence, and risk factors. These are my disclosures. I am a medical science liaison with Johnson & Johnson Innovative Medicine. My background includes Doctor of Nursing practice. I did practice at Thomas Jefferson University in Philadelphia for many years in the Department of Urology and with the Sidney Kimmel Cancer Center. I was the director of the AUA APP National Program and was a board member of the Urology Care Foundation. The global prevalence of prostate cancer is the second most common cancer among men worldwide. Over 1.4 million cases were diagnosed in 2020. The most common site that we see diagnoses are in North America, Europe, and Australia, and the lowest are in Asia and Africa. In the US, it continues to be the most common non-skin cancer among men in this country. 1 in 8 men will be diagnosed, and that includes all men. There will be nearly 315,000 new cases this year alone. It is the second leading cause of cancer death in US men. Here you can see those statistics again, but as you'll see on the right, the 5-year relative survival for patients with prostate cancer is nearly 98%. What that tells us is that we're treating it much earlier in the disease state. Here you can see the historical trend. So back in the early 90s, we were diagnosing a lot of patients and treating a lot of patients. We saw a decline when guidelines changed briefly for the period around 2011, 2012, and you can see that we're starting to pick that up here as we approach 2025. Age is a risk factor. The older a man gets, the more likely he is to be diagnosed with prostate cancer. It's very rare in patients under 40 years of age, and 60% of cases occur in men over 65 years of age, with the median age at diagnosis being 66 years. African American men tend to have the highest risk. They're more likely to develop aggressive forms of prostate cancer with higher mortality rates. And we do see lower risk typically in men of Asian and Hispanic descent. Family history is really playing a big role here, also with genetics. Having a first-degree relative, including a father or a brother with prostate cancer, doubles a patient's risk of developing prostate cancer. Certain genetic mutations, including BRCA2, HOXB13, and many others, does increase the risk. And there is an association with Lynch syndrome as well. We do know to some extent that lifestyle and diet play a role. Obesity is linked to more aggressive disease. Diets high in red meat and dairy may increase the risk. Physical activity may help to lower the risk. And smoking is associated with higher mortality. Other potential risk factors include inflammation of the prostate or prostatitis, exposure to certain chemicals, like we saw with Agent Orange. And there's still ongoing controversy with whether or not high testosterone levels play a role. In summary, prostate cancer is common, especially in older men. Major risk factors include age, family history, and genetics. Healthy lifestyle may help reduce the risk, and early detection is key to improving outcomes. These are my references, and I thank you for your time.